Hey there, fellow cat lovers! We all want our furry friends to be as healthy and happy as possible, right? But sometimes our cats can't tell us when something's wrong. Today, we're going to talk about 8 signs that your cat might need a vet visit ASAP. Trust me, you don't want to miss this important information. So, grab your kitty, get comfy, and let's dive in. Alright, let's get into it. The first sign you should never ignore is changes in coat or skin condition. A healthy cat usually has a shiny, smooth coat, and their skin should be clear without any redness or bumps. If you notice your cat's fur becoming dull, thinning, or if they're shedding more than usual, it could be a sign of an underlying issue. Skin problems can indicate allergies, parasites like fleas or mites, or even more serious conditions like a thyroid problem or hormonal imbalance. Is your cat constantly scratching, biting at their skin, or showing signs of discomfort? Don't brush it off as just a minor irritation. Persistent scratching or the appearance of sores can be a sign that something's not right. Early intervention can prevent small issues from becoming big ones. Your vet can help identify the cause and recommend appropriate treatments. And remember, the condition of your cat's coat is often a reflection of their overall health. So if something seems off, it's better to be safe than sorry and book that vet visit. The second sign you should never ignore is sudden changes in appetite or weight. Cats are creatures of habit, and they usually have a pretty consistent appetite. If your cat suddenly stops eating, is eating much less than usual, or conversely is constantly hungry, it's time to take notice. A loss of appetite can be a symptom of many different health issues, ranging from dental problems to kidney disease or even cancer. On the flip side, an increased appetite could signal conditions like hyperthyroidism or diabetes. Weight changes, whether it's sudden weight loss or gain, are another red flag. Cats are notorious for hiding their illnesses, and a gradual weight change can go unnoticed until it becomes serious. Regularly monitoring your cat's weight can help you catch issues early. If you notice any significant changes, don't wait. Get them checked out by your vet. The third sign you should never ignore is vomiting or persistent coughing. It's not unusual for cats to vomit occasionally, especially if they're getting rid of hairballs. But if your cat is vomiting frequently or showing signs of nausea, like drooling or lip licking, it could indicate something more serious. Repeated vomiting can be a sign of gastrointestinal problems, infections, or even poisoning. Persistent coughing is another symptom that shouldn't be ignored. While it might seem like just an occasional hairball, chronic coughing can be a sign of respiratory infections, asthma, or heart disease. If your cat is coughing frequently or has difficulty breathing, it's crucial to get them to the vet right away. The next sign you should never ignore is respiratory issues: sneezing, coughing, or watery eyes. Cats can catch colds too, but if you notice your kitty sneezing more than usual, or if they have watery eyes, nasal discharge, or are coughing, these could be signs of an upper respiratory infection. While some mild infections can clear up on their own, others may require medical attention, especially if your cat is very young, old, or has a compromised immune system. In severe cases, respiratory issues could be indicative of more serious conditions like feline herpes virus, feline leukemia, or even pneumonia. Keep an eye out for labored breathing, open mouth breathing, or bluish gums. These are signs of a potential emergency and warrant an immediate vet visit. The next sign you should never ignore is litter box problems, difficulty urinating, or changes in habits. One of the clearest signs that something is wrong with your cat's health can be found in their litter box. If your cat is straining to urinate, making frequent trips to the litter box without producing much, or if there's blood in their urine, these could be signs of a urinary tract infection, bladder stones, or even a life-threatening blockage. Changes in defecation habits, such as constipation or diarrhea, are also worth noting. If your cat seems uncomfortable, or if their stool looks different than usual, it could indicate digestive issues or other health problems. These symptoms should never be ignored, as they can lead to more serious complications if left untreated. The next sign you should never ignore is behavioral changes: lethargy, aggression, or hiding. Cats are creatures of habit, so when their behavior changes, it's often a sign that something is wrong. If your usually playful cat suddenly becomes lethargic, or if your normally friendly feline becomes aggressive, it's time to take notice. These behavioral changes can be a sign of pain, illness, or emotional distress. Hiding is another common sign of illness in cats. If your cat is suddenly spending more time in dark, quiet places, or if they're avoiding social interactions, it could be a sign that they're not feeling well. While some cats naturally enjoy a bit of solitude, a sudden increase in hiding behavior is a red flag that shouldn't be ignored. The next sign you should never ignore is changes in grooming habits. Cats are meticulous groomers, so when they stop grooming themselves, it's often a sign that something is wrong. A cat that isn't grooming might be in pain, depressed, or suffering from a condition that makes it difficult to groom, such as arthritis or obesity. On the flip side, excessive grooming can also be a sign of stress, skin conditions, or allergies. If you notice your cat's coat becoming matted, dirty, or if they're over-grooming to the point of creating bald spots or skin irritation, it's time to see the vet. Proper grooming is essential to a cat's health, and changes in grooming behavior can be an early indicator of underlying issues. The next sign you should never ignore is neurological signs. Head pressing, seizures, or unusual eye movements. Neurological symptoms in cats are a serious concern and should never be ignored. If you notice your cat pressing their head against walls or furniture, having seizures, or showing unusual eye movements like constant dilated pupils, these could be signs of a neurological disorder, poisoning, or a brain tumor. Head pressing is a particularly alarming sign that something is wrong with your cat's brain, and it requires immediate veterinary attention. Seizures, even if they're brief, can also be a sign of a serious underlying issue that needs to be addressed as soon as possible. And there you have it, 8 signs that your cat needs a vet visit right away. Remember, when it comes to your cat's health, it's always better to be safe than sorry. If you notice any of these signs, don't hesitate to reach out to your veterinarian. Your cat's well-being is worth it. Before you go, make sure to hit that subscribe button and give this video a thumbs up if you found it helpful. Drop a comment below if you've experienced any of these signs with your cat. We'd love to hear your stories and advice. Thanks for watching, and we'll see you in the next video. Don't forget to subscribe and click the notification bell for more pet care tips and tricks.